Are you aware of what chronic obstructive pulmonary disease, commonly known as COPD, is, and the factors that put you at risk of developing it? The world of respiratory health is complex, but today, we're going to break down the basics of this disease and its risk factors. First and foremost, smoking is the leading risk factor for COPD. Cigarette smoking in particular is highly linked to the development of this disease. But it's not just the smokers who are at risk. Secondhand smoke exposure, too, is a significant contributor to the development of COPD. It's not just about the direct harm, but also the ripple effects that smoking can have. In addition to smoking, environmental factors play a significant role. Prolonged exposure to air pollutants, such as industrial fumes, chemicals, and dust, can increase the risk of COPD. This is especially true for those who work in environments where these pollutants are prevalent. Genetics also play a role in the development of COPD. Certain genetic conditions like alpha-1 antitrypsin deficiency can lead to early-onset COPD, especially in individuals who smoke or are exposed to environmental pollutants. Frequent respiratory infections, especially during childhood or later in life, can contribute to lung damage and increase the risk of COPD. Therefore, maintaining a healthy immune system and taking care of one's respiratory health is crucial. As we age, our lung function naturally declines. This makes advancing age a significant risk factor for COPD, as older adults are more susceptible to respiratory conditions. Finally, socioeconomic status is a factor that cannot be ignored. Lower income, limited access to healthcare, and inadequate living conditions can contribute to an increased risk of COPD. Individuals in disadvantaged communities may be exposed to more environmental pollutants and have limited access to preventive care. In essence, the risk factors for COPD are both controllable and uncontrollable. They range from lifestyle choices like smoking to environmental factors, genetics, frequent respiratory infections, aging, and socioeconomic status. By understanding these risk factors, one can take proactive steps towards prevention and early intervention. This may involve quitting smoking, reducing exposure to pollutants, seeking early medical intervention, or advocating for better living conditions and healthcare access. Remember, understanding is the first step towards action. Thank you for joining this discussion on COPD and its risk factors. If you like this video, please thumbs up, subscribe, and share. Stay tuned for more enlightening content. Until next time, take care.